Well, let's get more analysis now from Dr. Mohga Kamal-Yanni, who joins us from Oxford in the UK. She's a senior health policy advisor to the People's Vaccine Alliance. Doctor, why are we still seeing vaccine inequality more than 2 years into this pandemic and well over a year after the wide rollout of multiple vaccines?
Well, that's a good question. The problem was from the beginning, vaccines and medical products for COVID was left, the decision about these vaccines were left in the hands of pharmaceutical companies. So clearly they prioritize supplying rich countries where they can charge high price and make the profit that we hear about, eye-watering profit really. And that's why, countries like the countries in Africa were just back on the queue because they couldn't compete with the price. Also, even the COVAX, the scheme that was put together to ensure that developing countries have access to vaccine, actually didn't work because it just relied on one company, which is AstraZeneca, and AstraZeneca relied on their, another company in India to produce. And it's just a mistake that to rely on one company for the whole world. It just wouldn't work like that. And then, COVAX was saved by the donation from the US. President Biden in last G7 announced he will buy, well, the US will buy doses from Pfizer and Moderna and deliver them to developing countries. So we don't have a sustained supply for developing countries. It comes erratic of when something is available and somebody decide that it can go to this country or that country. It's not a sustained way of supplying, because as Dr. Tedros absolutely put his finger on the pulse by saying that the decisions are tied in the hands of a handful of companies. So there is no sharing technology, there is no sharing of knowledge or waiving intellectual property to allow producers in developing countries to produce the vaccine. And look at what's happening in the mRNA hub
Right.
in South Africa. Moderna is refusing to share the technology. So the mRNA hub are developing the vaccine themselves, but it will take them
Okay.
longer time because the Moderna are refusing to share.
Yeah,
So that's the,
and I certainly
sorry.
understand that the challenges of getting these pharmaceutical companies to share their technology when they're making, as you said, eye-watering profits. What about in developing countries where there's plenty of supply, but demand has dropped off, and we're still seeing high rates of coronavirus cases? How can these countries encourage people to take up the vaccine if they haven't already?
Well, to be honest, you've got a window at the beginning of the pandemic. You've got a quite few months of window of persuading people to get vaccinated. Well, we lost that window because there was no vaccines. So while campaigning on, go and get vaccinated, say in the UK, I can walk to a health center and I can get the vaccine. While in Africa, it wasn't like that. So the governments couldn't campaign. They couldn't, raise the awareness and raise the expectation of people to go to vaccinate because they didn't know when they will have which vaccine and how many doses. There was some stage when people in Nigeria had the first dose of AstraZeneca vaccine and they didn't know when they will have the second dose. So it's that window lost. Now people lost interest in and lost trust in the whole vaccination issue for adults. Because don't forget, people in Africa are used to vaccinating kids.
Hmm.
Vaccines are not a big deal for us because we take the kids, we get them vaccinated. When there's a polio campaign, everybody vaccinate their kids, and it's normal part of our lives. Vaccinating
Okay.
adults is okay, new idea, but it's the supply issue that led to decreasing demand. And now, of
Okay.
course, we're struggling with finance. In order to deliver, you need to train health workers, pay health workers. You can't dump the vaccine in the airport and say, right, I've got your vaccine. You've got the logistics, the supply chains, the cold machines to keep it in the right
Okay.
temperature. You've got quite a lot that needs cash. Where
Okay.
is the cash?
Okay, clearly a lot of challenges left to tackle when it comes to this pandemic. Dr. Mohga Kamal-Yanni, thank you.